Coronavirus disease, COVID-19, is a highly infectious disease that is thought to have emerged from the Wuhan, China in December 2019. In only a few short months, COVID-19 is now a pandemic and has changed the world as we know it. At the time of this video, there have been over 2.3 million confirmed COVID global cases. Schools are closed, economies are at a standstill, and many hospital beds are full. For a disease that has affected so many, there are exponentially more unknowns than knowns. Today, I'm with Dr. Ostrosky, who's a Vice Chair of Healthcare Quality and Professor of Infectious Disease at McGovern Medical School at UT Health, to help answer questions from our community. We're promoting and exercising social distancing by using this web platform. Good morning, Dr. Ostrosky, and thanks for joining us.
Good morning, Dr. Nguyen. Very nice to see you today.
So we collected questions from our community, and one of the obvious questions is that a lot of our members out there have either allergies to pollen, or they have a stomach ache, or they're just not feeling well. Should they avoid going to the doctor, or if so, how should they proceed about making appointments to see a healthcare professional?
I think you bring up a really important thing, which is with and despite COVID, people are getting their normal illnesses, not only allergies and respiratory symptoms, but there's people out there having heart issues, and they're having gastrointestinal issues, issues with their diabetes, etc. So it's very, very important to know that you have your physicians out there ready to see you. Due to physicians, we're offering options to do telemedicine, where you can have a consultation with your doctor by phone or with a video link. And you should also know that most doctors' offices are open to see you if you need to be seen in person. So definitely try to use those two options, either telemedicine or an in-person visit to be seen for your symptoms.
Well, on a similar note, let's say that our community think they might have coronavirus or COVID, or they're not feeling well, they have a fever, and they want to be tested for COVID. Can you elaborate on the process of getting tested for COVID and how they can proceed in doing that?
Perfect. So if you think you may be experiencing COVID, and again, the symptoms are going to be fever, shortness of breath, cough, sometimes diarrhea. Some people get issues with loss of sense of smell or of taste. Again, if you're experiencing those symptoms, you want to make sure you call us. We can do a phone consultation or a telemedicine consultation. And if appropriate, we'll order a test for you. This can be done in one of our drive-thrus. We have two going on right now, one in Victoria and one in Siena. And basically, all you do is we put in an order for you. You call 713-486-CO19 and schedule your drive-thru visit. And you will be driving through, getting the test done, and getting the results back in a timely fashion.
And let's say you're suspected or you're concerned you might have COVID. What are things that you could do practically at home to protect your family from potentially getting sick as well?
It's very important to try to isolate yourself as much as possible in the house. So definitely, if it's a possibility to have your own room and your own bathroom, goes a really long way. People should not be with you for the most part. They should be delivering meals to you and then collecting them and using disposable utensils and plates. Otherwise, they need to be washed thoroughly in the dishwasher, and people handling them need to wash their hands. Laundry should be done with hot water and soap. And again, people handling your laundry should be washing their hands thoroughly. So it is possible to sort of keep a house relatively segregated. You really just need to work at it.
And you mentioned the concept of food and using separate plates and utensils. You know, in a lot of cultures, we share food and that's very a common practice. Let's say if you don't think you have COVID or you're relatively don't have symptoms, is it okay to still share food when you're at home?
So I think this is a time to practice relative social distancing even within the home. Obviously, no sharing food is going to be very important. And again, a little bit of intimate and sort of casual contact is okay, but if you think you may have the disease, it's very important to distance yourself from the rest of your family.
We also know that a lot of patients who have COVID don't have symptoms, and a term in medicine we use as asymptomatic. Um, can you still be contagious if you don't have symptoms and you have COVID? And if you don't have symptoms, then how do you know if you have COVID? What can you do to try to figure out whether or not you have COVID?
That's a really good question. From surveys that are being published, we've seen the carriage rate of COVID in asymptomatic people be as low as 1% and as high as 10%, depending on the population. So we do know that a certain amount of the population may be carrying COVID and not be symptomatic, not experiencing the fevers, the cough, etc. What we don't know is how effective these people are in actually transmitting the disease. We don't know if we're just detecting dead virus in their nose and in their throat, or if they're actually able to transmit the disease with this. This answer is going to be coming up in the next couple of months.
And let's say if you do have COVID and you're COVID positive and you're at home, you're quarantined and you're treated, what's a process for returning back to work? What tests need to be done and what precautions should be done when you return back to work?
So you definitely want to stay home until you're cleared to return to work. There's two pathways to do that. The pathway where you have testing available to you requires you to be asymptomatic for a minimum of 3 days and have 2 negative viral tests within 24 hours of each other. Again, this is a little bit complicated because it requires you to get repeat testing, and we've seen some people that actually continue to test positive for a couple of weeks. So definitely something to consider. And then the other pathway is based on symptoms, where you need to be asymptomatic or minimally symptomatic for at least 3 days. And it needs to be at least 7 days from the onset of the illness. So the quickest you can come back to work would be 7 days with being asymptomatic for at least 3 days. But again, we do have testing available, and most of us are recommending to be tested before you come back to work.
Is there anything that we can do to prevent ourselves from getting COVID? Maybe exercising more or eating certain kinds of foods, or maybe even taking vitamins. What's your recommendation on that?
Definitely a healthy lifestyle goes a long way. Keeping healthy, doing moderate exercise, eating well, getting all your vitamins in. There's some people that mention vitamin D as a vitamin that decreases respiratory infections. There's actually no clear evidence that taking vitamin D supplements would decrease your likelihood of getting COVID. But you will see that out there. Same for vitamin C. So I think in general, having a good diet with a variety of fruits and vegetables, protein, will keep you healthy. And again, I think the number one way not to get COVID right now is to really social distance yourself. Stay at home and don't go out there to do anything that's not absolutely necessary.
You know, in Houston, we have a lot of mosquitoes, and mosquito season is somewhat around the corner. Can you get COVID from either mosquito bites or even bites or tick bites?
There's no evidence that COVID is transmitted by any insects or animals, for that matter. A lot of people ask about dogs, and we know that dogs aren't carriers of COVID. We've seen some evidence maybe about cats, but not really about dogs. And what is really interesting, though, is that if you are sick with COVID and you have a dog in your house, you can actually sort of contaminate the dog's coat. And then when other people pet your dog, you can get it, right? So it's very important to segregate pets as well when somebody has COVID in the house.
Oh, that's interesting. But dogs also have a coronavirus as well that they can get sick from. Can you explain how that's different than what humans have potentially can get?
Perfect. There's actually many coronaviruses in nature, and they're usually species specific. So, for example, we have human coronaviruses before this that are actually the most frequent cause of the common cold. And dogs have their own, cats have their own, and they usually don't jump species. We are in trouble when they jump species, as it happened with this particular coronavirus, where we think this is a bat coronavirus that made the jump, and we obviously don't have immunity to it. and that's why it's spreading so fast.
Where you're talking about the virus and jumping species and whatnot, there have been some dialogue that this virus could have been fabricated in a lab, or it might not have come from animals per se. What are your thoughts on that? Is there any scientific basis for that possibility?
The short answer is no. This is purely a conspiracy theory. We know this is bat coronavirus. It's totally compatible with what we would find in bats. And it really makes for a good story to say that this was a virus that escaped from a biosafety lab or was being used to manufacture vaccines or as a bioweapon, but it's really not the truth. Most experts agree now that this is a naturally occurring virus in bats and that it made the jump.
So somewhat similar related, we get a lot of imports from China for various products and whatnots. Is there a potential to get coronavirus if we have a package delivered from China, or is there a possibility of getting coronavirus if our mailman has the virus, or we get mail from a friend who has the virus and it ends up in our mailbox?
Excellent question. And this question has been asked since the beginning of the outbreak when it was really localized to China. There's no evidence in the scientific literature that this virus can be transmitted in packages. There's been many studies that look at survival of the virus in surfaces. And we know that at most it can survive up to 3 days in sort of metallic and plastic surfaces, about 1 day in paper and carton. So the time it takes for packages to get from China to here, or even in between different houses in city, would pretty much make sure that those are really decontaminated. Some people choose to have a little quarantine area in their houses where they drop off any mail and packages and don't touch it for a couple of days. I think that's something you can do to make extra sure.
Should we be wiping down our mail if we get it, if we want to open it right away, or is that possible? Or what's your recommendation to try to how to handle mail items that we need to actually open up?
Again, there's no evidence that it can be transmitted by paper or through the mail. But let's say worst case scenario, your mail carrier had the virus and handled your mail. What you can do is place it in an area that you can wipe after you open it and wash your hands right away. You'll be totally fine.
On somewhat a related level, what about food from the grocery store? So fruits that's exposed and apples out there, and I'm sure people putting their hands in and picking apples and you bring it back home. Should we be doing anything to clean the food we get from the grocery stores? Has there been any data of transmission from contents at the grocery store?
We have not seen any reports of people getting sick from eating or handling grocery store items. Again, some people choose to wipe their groceries when they get them, when they get home. And for sure, what we're recommending is to rinse and wash your fruits and vegetables. Again, at most, this virus is going to survive in surfaces for about 3 days. So other people choose to, again, have a little quarantine area in their house and put their groceries in timeout, those that are not perishable, and then they'll be totally fine.
I'm going to get a little more scientific in the next series of questions. Can you explain the concept of herd immunity? We hear that a lot. How does that apply to COVID? Another question is that a lot of times there are parallels with COVID and the flu. And at some point, all of us have had the flu. At some point, will we all get COVID and we'll just get a more mild version of it? What are your thoughts?
So the concept of herd immunity is based upon the fact that when a substantial amount of the population gets a disease and becomes immune to it, there's really no host for it to transmit efficiently, and it kind of goes away, dies off, right? So most people think that to achieve herd immunity, we need about 60 to 80% of the population infected and immune with the disease so that there's no readily available host out there. We're very far from this for coronavirus. We've seen it happen with a lot of the viruses where, when we vaccinate people and we reach about a 60 to 80% vaccination rate, we actually stop seeing transmission of the disease in the community. This concept is really important, particularly for immunocompromised hosts that cannot be getting vaccines or are at very high risk of getting an illness. If the whole community around them is immune or protected, those hosts are protected by that fact. So very important concept to look forward to. We don't have evidence that we have herd immunity at this point. And in fact, infection rates in major metropolitan areas are probably less than 10% at this point. What else is the question?
And the other question is, do you think, similar to the flu, at some point everyone will have or get COVID and perhaps a more mild version of it?
So yeah, I actually don't like contrasting COVID too much to the flu because it is more contagious and it may be more severe. But eventually, yes, enough people are going to get this that it's going to become less efficient to transmit in the community, and most people are going to become immune to it. How fast that's going to happen is the question. And unfortunately, again, with flu, we have low mortality relatively, and this is probably double or triple the mortality that we see with flu. So concerning.
Do you think COVID is something that we're going to see only this season, or is it going to be a recurring theme in the future where we'll have to deal with for subsequent years from now?
So there's three scenarios we're looking at here. One is that, as with SARS, it just goes away and it doesn't come back. So that's one scenario. The other scenario is that we continue to have low-level transmission of COVID after this big peak and hopefully avoid a second peak immediately this summer. And the third scenario is for it to go away in the summer and then continue transmitting in the winter season for the southern hemisphere, and then come back to an hemisphere in the winter again, where we could have again transmission. I think most experts are leaning towards this becoming kind of an established virus in our society, and continue to see it particularly in the winter months.
Dr. Ostrosky, as you know, I'm a heart surgeon, and many people ask, can COVID cause heart attacks or cause strokes? Is there any particular risk of COVID to our cardiovascular system, maybe more so than other systems out there?
Absolutely. This is one of the main areas where COVID affects patients. We do have an incidence of about 10% of COVID patients having heart issues, going anywhere from heart attacks or stroke to arrhythmias to inflammation of the heart muscle, myocarditis. Those are common heart presentations of COVID. And I'm also very worried about people with heart issues not getting the care they need. Their sort of the surgeries for the heart, their catheterisms, etc. And we're going to see a toll of this epidemic in the normal sort of underlying heart illnesses that we see in our community. So very concerning that we are going to have a lot of heart problems related to this.
And I want to reinforce that to our community, that if you do have heart problems or chest pain, even though right now we're in the middle of a COVID pandemic, it's important that you go and you seek care from a healthcare professional, whether that be initially through telemedicine or actually or showing up at your physician's office. Dr. Ostrosky, as you know, COVID has really kind of turned our world upside down. At some point, we're going to return back to normal. But the question is what our new normal is going to be like. Can you provide some thoughts on what you think the future is going to be like? What's going to be our new normal? Are we going to all walk around wearing masks? Are we going to all get vaccinated? Just kind of broad strokes, what you think the new normal is going to be when the COVID dust settles.
So as you will say, it's going to be a new normal, not the old normal. I do see that we're going to very gradually open up our society. It's not going to be like one day we're going to declare this is over and everybody goes out to eat at their favorite restaurant and to see the grandparents without wearing any mask. I think we're going to be gradually opening the society, figuring out how to do this in schools, how to do this in hospitals and businesses. I do foresee us wearing masks for a while until this is really under control. And if we're able to measure antibodies and if they actually correlate with protection from new cases, again, this is a couple of big ifs, I can see a world where people get tested, check their antibodies. If you're antibody positive, you're clear to go about your business and travel and work, etc. If you're negative, that's a situation where you want to protect yourself more and continue wearing masks and continue practicing social distancing. I do see a vaccine coming. There's several candidates being investigated, but unfortunately, it's not going to happen before a year or two. It really takes a long time to develop vaccines, and even in an accelerated timeline like we're seeing, about 12 to 18 months, you really want to make sure that vaccines are very safe because you're giving them to healthy people and that they actually have the protection that they're intended to have. So we can't rush a vaccine, but I do see a lot of vaccine research coming, and we're very hopeful that we'll have one within 12 to 18 months.
You brought up a couple of interesting points, and I want to ask two additional questions and we'll close. Do you envision at some point everybody will be tested for COVID? Everyone in our community will get a routine testing for COVID. And you also mentioned face masks. When should we wear face mask? What should we wear as our face mask? And for how long should we be wearing it?
So I do see us doing very broad population testing, both for acute illness. When you have a respiratory illness, you should be testing for the active infection, the nasal swabs that we will see. And I do see this testing becoming more readily available in the community, where it's not a big sort of to do a big production to get tested. You could just get tested in your doctor's office like you would with the flu, or any retail location, etc. And I do see us doing broad antibody testing to really see what the sort of penetration of this disease is in the community. And perhaps, again, if antibodies correlate with immunity, to see if we can clear people to come back to work. Regarding masks, I do think they have a very important role in this illness. You definitely want to be wearing a mask anytime you're in public with other people. It's probably okay to not wear a mask like you and I when we're in our private office. But if you're in the office talking to other people, etc., it's a good idea to be wearing them. If you're out on the street, anywhere public, you should be wearing a mask. In general terms, we like to not wear masks for more than one day. So definitely if you have a cloth mask, you need to be washing it and changing it out every day. Or more often if they become saturated with moisture or soiled, or they don't do the function that they're supposed to do. If you smell things through the mask, you probably need to be changing that as well. And again, for the population at large, it's probably okay to be wearing cloth masks. For healthcare, very high retail jobs, etc., it's better to wear sort of the surgical grade masks that have a higher degree of filtration.
And you hinted at the mask being our new normal. Do you imagine us wearing masks out in the community 2 years from now, 3 years from now, 10 years from now, where 80% of the people that we see in the subways and the grocery store will be wearing masks? Is that going to be part of our new normal as well, you think?
I think we're probably going to be wearing a mask to some degree until we can show immunity or until we have a vaccine.
Thank you.
Mm-hmm.
Dr. Ostrosky, you've been a leader in helping us understand COVID and how it affects our population here at McGovern Medical School and UT Health. Do you have any closing thoughts for our viewers out there as they try to get a grasp on the COVID-19 pandemic?
Absolutely. My main thought for this is that we need to continue the social distancing. That is greatly flattening the curve for Houston, for our country as well. We're seeing about half of the cases we were projected to see by this time. So definitely continuing the social distancing and all the measures we're following is going to be very important. Second thought is, again, I'm very worried that people are not going to be accessing healthcare when they need it out of fear of COVID. So by all means, if you're having any heart attack symptoms, any stroke symptoms, if your rheumatic disease is out of control, please, please, please access healthcare, come to your office, your doctor's office, and get that taken care of, because the toll of this disease is going to go well beyond the actual infections. We don't want to leave the population unprotected for their normal medical needs. So you should know that UT Physicians is here for you. And my final thought is really, we're going to get through this all together, and working together is going to get us through this historical event that we're living in.
Well, Dr. Ostrosky, again, thank you for your leadership. And I want to echo Dr. Ostrosky's comments that we need to take care of ourselves. And if you have any medical problems, don't hesitate to seek care from a healthcare professional here at McGovern Medical School, UT Health, or anywhere. It's important that you get care during this time. Thank you for viewing this webinar experience. And if you have any questions, please submit them to us. Stay safe out there.
Thank you, Dr. Nguyen.
Thank you.